Hey everyone, in this video we're going to be covering the brachial plexus. We're not going to go in depth of all of the nerves that can be found coming off of the brachial plexus. Um, we're only going to go through the nerves that are sufficient for what the course is asking for. So um, we're going to cover some stuff that we might have covered in the past, but that way you can just understand how everything ties in together. Um, so let's go ahead and dive in. So, first things first, I put the SCM, the omohyoid, middle and anterior scalenes in the model. This way we can see where the brachial plexus is coming through, right? So you've got your muscles right here, like I said. We're just gonna slowly remove them. But omohyoid right there, there's superior belly, inferior belly, uh, your anterior scalene and the middle scalene. And as you can see, that brachial plexus is coming through right there. Just getting rid of these. And then, like I said in the textbook video, if you've watched it already, this might be just a reminder, but all of the nerves that are coming out underneath your cervical vertebrae number 5, um, they are coming below, meaning like here's your 6 cervical vertebrae, but the spinal nerve, well, the nerve coming back into that vertebrae is going to be number 7 underneath 6. That's what I'm trying to um, illustrate here, just for your understanding. So, like, you have your 7th cervical vertebrae. This one is going to be the 8th cervical nerve. But if we come up to the 5th, below it we have the 6th cervical nerve, but above it, that's where the 5th is. So everything above C5, that's where that respective nerve is going to come out. So 5th cervical vertebrae, 5th spinal nerve coming right out from above. But everything below the 5th vertebrae, the uh, correlating vertebrae with nerve will be above it, if that makes sense. Then, if you're following along in the textbook, you should have seen like a transverse cut where you just see like somebody had cut a line straight through a cadaver, which is parallel with the ground, and you're seeing the view from this angle right here. Like you're seeing everything right there. Well, that cut, just so you can understand a little bit more, on that page, you have nerves 14, 15, and 16. So you have like a lateral cord, medial cord, and a posterior cord. That's what they're talking about right there. And then you've got specific nerves coming out of those. And we won't need to know these for this course, but I'll try and clarify which ones come out of which cord just to help you. But let's start with the ones that we do need to know. So let's come down here. So if we stay on the anterior position, starting on the medial one, there's your median nerve right there. And when it comes to the median nerve, this is gonna innervate your forearm flexors except for flexor carpi ulnaris. Okay. And if we come back up here to the top, it's crossing on the anterior side of that medial epicondyle, coming up the arm, and then it is gonna be coming out of that lateral cord as well as the median cord. You're gonna have that median nerve is going to, I guess, bifurcate, if you want to use that word. But there's two different cords that make up the head of this median nerve. If we want to look at the ulnar nerve, this one's going to stay even more medial than the median nerve, but it's going to run on the back side of your medial epicondyle. You ever smack your funny bone and it like kills? You're smacking that ulnar nerve. So it runs behind the medial epicondyle, but then it ends on the anterior side where your carpals are. This ulnar nerve, it's going to innervate both flexor carpi ulnaris and flexor digitorum profundus. Okay. Your radial nerve, it's going to come around this back side. Let's see right here. And this nerve right here is going to innervate all of your forearm extensors as well as your triceps, which makes sense, right? I mean, it's coming on that posterior side. It's running right underneath this, well, it's running right in that radial groove. So it's going to have these branches that innervate the triceps that are back here, and as well as all these forearm flexors, because it will come back and run down right there. Let's see if I can get these branches right here. So that's the branches that come off of it. But as you can see, we're labeling it as like, this is that radial nerve. All right. Then we need the musculocutaneous. This is gonna innervate all of these, like your brachium muscles. So like coracobrachialis, biceps brachii, and brachialis itself. So let's get rid of these ones that we've looked at. Now coming up right here, this is going to be your axillary nerve. And it's coming from that posterior cord in blue, as you can see. This axillary nerve, it's going to innervate the deltoid and the teres minor. If we look at the branches coming off of that, you can see like why that would make sense, right? Because if you have your deltoid muscle, well, let's just put that in. You see that branch that just sits right there, right? Sitting in inside that deltoid, which allows it to be innervated. But if we hide this and put in our teres minor, you can see that axillary nerve makes a lot of sense to innervate this one, right? Because we just have it. The axillary is coming around the neck of the humerus, and it's that teres minor just sits so low on that greater tubercle that it allows it to just be innervated by that nerve. So let's go ahead and get rid of these. That's it for the ones that you need to know. If you remember the acronym MMURA, those are the ones that you're mostly going to be tested on in this undergrad course. But some of the others that you might be accountable for, we'll just go through them and I'll get rid of them as we go. But inferior subscapular muscle, nerve. This is also known as your lower subscapular nerve. This is going to innervate your subscapularis and your teres major, okay? Which subscapularis would make sense because that muscle is coming from that not supra, but subscapular fossa, coming around and it's coming to this lesser tubercle, as well as that teres major is coming through here, through that armpit, coming around into your intertubercular groove as well. If we want to look at the origin, it's coming from that posterior branch of the brachial plexus. Okay. And then let's look at superior subscapular. So this is going to be your inferior. This is going to be your superior or upper subscapular. It's just going to innervate your subscapularis. Okay. That's also coming from the posterior branch. Now, if we look at the median pectoral, okay, median pectoral, that one's gonna innervate pec major and both pec minor. And if you remember, pec major, it's gonna run right along the sternum, where it's gonna be its origin, and then it's running along this clavicle as well, and then it's coming around into that humerus, and it's gonna insert right in that intertubercular groove. So I mean, it's gonna come right through where that nerve is. But then you have your pec minor, which is coming from that coracoid process of the scapula, and it's coming down and it's inserting on ribs 3, 4, and 5. And so knowing that, that makes sense why this nerve is going to innervate that muscle. And then we need to look at this nerve right here. So looking at this is coming from the superior trunk of the brachial plexus. Just looking at this, I hope you can just guess which muscles are going to be innervated by this. There's two of them. One sits right here in that supraspinous fossa, and that other one sits in the infraspinous fossa. So supraspinatus, infraspinatus are going to be the muscles that are innervated by your suprascapular nerve, because it's coming right there into that fossa, but then it dips underneath the spine of the scapula, underneath the acromion, and right there along that scapula, that shoulder blade. And then the last one I think I really need to show you is going to be this one right here, this lateral pectoral. If you had to guess which muscle this one innervates, it's just one, and it's already been talked about. It's the muscle that comes over into the sternum and into that clavicle, right? So knowing that, it's going to be pec major. So these nerves are not very difficult to understand which muscles they innervate, as long as you understand where they are on the body. If you understand that, then it makes more sense on exactly which muscles are innervated by what. So, just to recap for your notes, if you need it, you have your musculocutaneous, which is going to innervate coracobrachialis, brachialis, and your biceps. Your median nerve is going to innervate all your forearm flexors except for flexor carpi ulnaris. Your ulnar nerve is going to innervate flexor carpi ulnaris and flexor digitorum profundus. Your radial nerve is going to innervate all of your forearm extensors as well as your triceps. Your axillary nerve is going to innervate your deltoid and teres minor. Your upper subscapular or suprasubscapular nerve is just subscapularis. Your lower subscapular or your inferior subscapular is going to innervate subscapularis and teres major. Your median pectoral is pectoralis major and minor. Suprascapular is supraspinatus and infraspinatus. And then lateral pectoral, which is the last one we just talked about, is going to be your pec major. So if you got all that written down and you can remember that, I say you're doing pretty good on the nerves, especially on the superior part of the body, going into the extremities. So I think that's going to be it for this video. Please leave a comment below if you feel like there was something I could have done better, or if you wanted to see something just a little bit more. But until next time, we'll see you in the next video.
Alright, I just want to give credit where credit is due. These are the books and the resources I used for the videos. So first we have Essentials of Human Anatomy by Dr. Kurt Walker. We then have Essential Clinical Anatomy by Keith L. Moore and M.R. Auger and Arthur F. Daly. I also used Structure and Function of the Human Body by Mark Nilsson and Jamie Garbett. The last book I have is The Concise Book of Trigger Points by Simon Neil Asher. And then I used the app called Complete Anatomy. As you've seen from the videos, it's amazing. If you can afford it, I suggest it. It's such a useful tool when learning this stuff. So that's it. Have a good day.